up again. Now, this be the first time that we've done this with a large group where we're taking questions and answers from the audience. You may know, if you've been using Zoom, that you have the option to raise your hand or to type a question into the chat window. And when you do that, we will see that chat. And I see that we already have. Thank you. Oh, let's see. I don't want to use people's names, so in case they don't want.
I almost said it too.
Yeah. So just in case people don't want that. But anyway, how about I'll read the question and I'll toss to you, Nina, and you will answer it, and then
You betcha.
take turns. All right. So here's a question: is it okay to work with a 6-year-old on gliding? I spent weeks modeling easy, relaxed speech for a now 6-year-old boy. He noticed and imitated my utterances at times, but continued to have difficulty starting. I introduced gliding before school ended using sticky tacky putty, and it seemed to help him start easily and not experience many iterations starting. So excellent. Oh, and here come the questions. Beautiful. So great. This is what we want. So Nina, why don't you start off with that first one, and I'll back on if you want.
I'm going to have to make an assumption that I know what gliding is. I'm going to, because it's not a term that I use, but as you're talking in your question about, modeling easy, relaxed speech at the beginning, and now he's imitating your utterances, I'm going to assume you're talking about an easy onset, like a smooth,
Yes.
easy start.
Just got confirmation of that. Thank you. Yes.
All right.
That's what she's talking
about. You got
about.
it? You got confirmation? Okay, because I can't read and talk at the same time.
Yeah.
I am a multifaceted
I can't
human.
think and talk at the same time.
If you saw the screens right now, you'd be going like, wow. So let me say that not knowing the child that you're working with, but generally, it's a child at 6 years old who is having some trouble beginning his utterances. To help him learn how to get that timing and tension in a smooth way is absolutely appropriate. There's a lot of, the setup that Scott was talking about. And of course, we write entire books on this. So there's a lot of information that comes as we build towards this. But yes, as we're helping a child see they can start out in an easier way, that is absolutely appropriate. For them to have that feeling of starting out easy is great. For them to know that their speech machine isn't broken and that they can have that and feel it. It's very reassuring and reinforcing. Note of caution, of course, is understanding that we have to help the parents know that just because we're starting with a technique and that we're helping a child learn how to do this in a very structured environment doesn't mean they're going to do it at home. So I have many parents who will, let's just use easy onsets as an example. We learn the easy onset and we're at the word level, phrase level, maybe sentence level in a structured therapy setting. And parents are wondering why their child isn't using their strategies all the time. So we have to help parents and children understand that we learn these like we learn everything else. Let's piggyback to what Scott was just talking to us about with like riding a bike. You don't just always jump on. You have to learn, here's the handlebars, here's the pedals. I have to be able to, sit on the seat and feel comfortable before I even start while mom holds me as I start moving. These are all steps to being able to do it on my own. And we want parents and kids to understand a hierarchy as well.
I was muted. Sorry, just doing a little bit of background chatting here.
No
so
problem.
I'm just typing back and forth with somebody. I'll get an answer going on that one.
Okay. Do you want me to read you one, or shall we have someone raise their hand?
Oh, well, we've got a good backlog here to keep.
Okay,
we've
backlog.
got a few.
Let's go.
So,
oh, wow. Yes, we do.
So let's talk about concomitant disorders for a moment. Concomitant speech sound problem or concomitant language problem. And again, we're going to keep our focus on the Q&A right now to the preschoolers because that's our topic today. But I am keeping track of any questions that come along that are for the older ones, and we'll respond by email or we'll make it one of the key topics in one of our upcoming office hours. I'll say that in particular about the issue of mid-word and word final disfluencies. One of our favorite topics because it comes up all the time now. But that's typically something we see in a little older child. So we'll hold off on the answer to that one. We'll get it back to you either on an office hours or by email. We'll get you something. But what about kids with concomitant disorders? You want to start off on that one?
Oh, we're throwing it to me. Okay, you betcha. Um, I've child. Okay, so I see the question. So generally, I think the question surrounds how do we focus, what do we focus on? If there's a child who stutters who has other things happening in their speech and language, or maybe a coexisting issue that is outside of speech and language, I have some general guidelines for myself. Okay. The first informal one is what's going to give me the most bang for my buck, which is a very American saying, which says, what am I going to help this child with that he's struggling with most, that in turn gives him the most trouble communicating? And so that focus on communication is a very important way to help you decide what to focus on first, how to blend the next thing in. All of these things are just clinical decisions you'll make spot by spot with the child that's in front of you. Generally, though, whatever will help the child be able to be understood and communicate his message is important. So let's take a young child who has phonology and stuttering. Okay, you're not going to just work on the phonology and ignore the stuttering. Okay, but you may have to compartmentalize or maybe lean towards phonology for a while, depending upon what's happening with their stuttering, to help them actually become more intelligible and get their point across. Depends on how much they're struggling. Yes. And so all of the things with supporting the home environment and getting the parents to understand stuttering and helping the child learn how to what parts of our speech machine we use for talking, those can all be done while you're doing phonology therapy as well. Okay, and so I've done a mixed bag where I'll compartmentalize my sessions on one or the other, or first part on one thing, second part on the other. There's so many ways to blend this, but focusing on communication, I think, is the overarching idea. Scott, did you want to add anything to that?
Nope, I agree 100%. So I'll
Well,
take the next one then.
write that down.
um, well, because that never happens, right? All right, so the next one I've got here is any tips for conducting an evaluation through teletherapy? And indeed, right now that's our only option. Here's how I think about this. First is it's going to depend upon the age group that you're talking about. All right. But we're talking today focusing on the little ones. So let me keep my answer there. We'll do one of these focused on
Mhm.
school age as well at some point, and we'll address that. For me, the key question that I'm trying to answer with the evaluation of a preschool child is this child at risk for continuing to stutter? And there's been a ton of research focused on this question over the last couple of decades now. And we know a lot. We don't know everything, but we know a lot about what puts some children at greater risk for continuing to stutter and other children at a greater likelihood of recovery. Because we know that many preschool children do indeed grow through their stuttering, it's part of their development, and then they stop doing it as their language and speech skills mature. We want to try to separate out those who are most at risk so that we can be sure to provide treatment to them. That doesn't mean that we won't also help the other kids. They may need it as well. But what we look for in the risk factors are actually things that we can get through teletherapy almost entirely. For example, the most important risk factor is whether there is a family history of stuttering. We know that there is a strong genetic component to stuttering most of the time. We can't always find it, But most of the time, when you have one person in a family who stutters, there is also another person in the family who stutters. And that tells us that that is the genetic aspect. Well, we can find out if there's family history of stuttering remotely. In fact, I often start that with a case history form. I use the checking in forms that we have in our books. Those are my background information forms that I send out to the families. And in there, it asks about family history. Now, I follow up on that in the interview with the parent because it turns out that parents aren't great at providing an answer to that. They'll do things like say, no, I can't think of anybody in the family who stutters. I say, okay, great, and I'll make my decisions based on this no family history, right? Lower risk. And then just as they're leaving, they'll say, oh yeah, but you know what? There's that uncle. We have an uncle, yeah, but we don't spend much time with him. Like, that's not genes. That yeah, okay. So anyway, we do review it with the parents and go through it, but you can do that online. Other things that we look at, aspects of the child's language development, child's speech development, the child's temperament. The longer the time since onset, the more risk. All of these are things that with preschoolers we can get remotely because most of it is going to be with parent interview, which I know that's often very hard to get. But if there's any silver lining to the kids being at home with their parents right now, is that we might be able to get a parent interview during the evaluation. Importantly, for the young children, 3 and maybe even 4, how much they stutter is not one of the key risk factors. So, yeah, you take a speech sample because everybody wants you to, but really it's these other factors that are playing a bigger role. And those are things that we can learn even remotely. So, schedule an interview with the parent, get information about the child's speech and language development. If you can do an assessment online, I've seen people putting together some very fancy document camera setups so they can have their iPhone shooting down over their Goldman Fristo laid out on the table. Great. But if not, a conversation with the parents, a conversation with the child will, for a preschooler, give you most of the key information. Things change a little bit if we're talking about other kids and if we're talking about other conditions where you might need to do a formal language assessment. But in stuttering, our risk factors are perhaps a bit easier to gather remotely.
And I agree, Scott. And just know that so many times with early childhood kiddos in my district here in Texas, lots of times we get a video from the parent, to do the other parts of the eval, to actually watch what's going on with the child. And that's something you'll be able to get fairly easily in this environment right now. And so all of those things that Scott just talked about, especially in early childhood, can be gathered fairly easily through telepractice. Just have to be a little creative. Scott, I have one I want to read to you, if you don't mind, if we'll go on.
Go for it.
And I'm back. It sounds like there's two of them I'm going to fold in together, and you can jump in.
I was going to do the same thing.
Oh, well, I
Great.
beat you to it. So there.
Yep.
So what do we do if a child remains at the same level and and this positive attitude from us doesn't really work? I know that stuttering isn't going to get better all of the time. And then there's another question down a little farther that, sort of feels the same attitude uh, question. If the child's aware of stuttering and this seems to affect his emotional development negatively, what do you think about whether he gets support from a psychologist?
Sure. Excellent. Great
Mhm.
questions. And indeed, I should just point out we may not get to all of there's a lot of great questions. We'll make sure we get to as many as we
Yeah.
can. But those two, terrific. Okay. Um, Stuttering's hard. Let's start from acknowledging that for the child, he may really be uncomfortable. He may really be scared. And when parents are modeling a positive attitude and acceptance, that can help, but it's not magic, unfortunately. And we know that some children are just more reactive to things than other children. That may or may not be related to their stuttering at all. Some kids get more upset when they fall down and skin their knee than other kids. So if the child is upset more, and if this is affecting his overall attitude, then one of the things that we face as a problem in our field is people typically, not typically, often just sort of panic and say, oh, we got to work on the fluency. We got to get him fluency because he's feeling bad. But instead, let's think about, well, if the problem is that he's feeling bad, let's work specifically on helping him feel better. This can be done in the context of speech therapy if two conditions hold true. One, the clinician is sufficiently trained to be able to do that. And two, the negative feelings are about speech. If the negative feelings are not about speech and communication, then it is very appropriate at that point to refer for an outside evaluation by a psychologist who specializes in child development. Okay, so I never hesitate to make a referral if the issues are not related to speech. That's just scope of practice issues. Okay. But also, if the clinician is not feeling comfortable with helping the family deal with those emotions, and if you're in a situation where you have the opportunity to refer, you should still do it at that time. But if you're comfortable and if it's speech related, then we may need to be more direct in our work on attitudes with children. What I talked about before and what Nina talked about before during today's recording was focused on these environmental changes and the beginning of some work on the child on attitude and creating acceptance. But there's much, much more that we can do on those topics of direct work on acceptance, like we do with school age children and adolescents and adults. And if we have a child where these environmental encouragements that we put into place aren't sufficient, then I'm going to roll up my sleeves with that child and we're going to do, even if he's quite young, some direct desensitization work. I've done pseudo stuttering work and voluntary stuttering work with little ones. It's not the first thing I do because there are other ways to reduce the water in the bucket for many children. But if for this child, for whatever reason, those negative emotions are persisting, well, A, that probably means that there's a greater likelihood of continuing to stutter because of the emotionality. But B, that's what I want to help the child with. So we're going to get more specific. And I'm going to fold in here just a third question related to this that somebody asked about voluntary stuttering for desensitization and whether we can highlight that for the child. And in fact, the answer is absolutely, we can highlight it. We don't always need to. Sometimes we can just model some disfluencies in our own speech and demonstrate acceptance of those, and we don't have to draw it to the child's attention. But if the child is having negative attitudes, if the child is demonstrating fear, then it's very effective to show the child, oh, yeah, look, right there, I had a little trouble getting that word out. But you know what I did? I said it anyway. Yeah, that was pretty good. And then we let the child know that even when he's stuck, he can keep on going. Nina, add on to that for me because I'll go on and on all day, but I should stop.
Oh, well, shocker. And I feel there's not a lot to add. I mean, Scott, you hit all of the high points and just making sure that, it's okay to stutter. See, what Scott just showed you in that little, vignette was that it's okay to stutter. It's okay to have trouble getting your words out sometimes, even for adults, especially for kids. And that, wow, that felt good. I said my word anyway. Now that focuses on the communication and not about the fluency. And so all of that wraps wonderfully well into helping kids develop these, really healthy communication attitudes, whether they stutter or don't. Scott, do you want me to try for, in 3 minutes or less, the last question
Can
we've got?
Can do. Just want to try to sum up all. Well, we take, as you're going to see in everything we do, we take a
Mhm.
communication orientation to stuttering therapy, not a fluency orientation. Fluency is just one small part of good communication. We don't forget about it, we don't leave it behind, but we also don't focus on it as the key area because communication is the reason kids open their mouths. So, yes, there are two that we haven't gotten to that I really
Oh,
want to get to.
All
first
right.
of
Would you
all.
do the one, because I missed the one at the end from the SLP who's a parent? I'll
You
grab,
want me to
but
do
you
that one?
must have seen one I didn't see.
Oh, there's one up above. So you do that one and I'll do the one up above. The one up
Okay.
above is how do you redirect parents who report myth treatment strategies as something they might want to try? For example, in popping her brother in the mouth with a dish towel every time he stuttered, the parent believes that that worked. Yeah, we've heard all of them and not all of them because people keep coming up with new ones. I was at one of Nina's talks one time, and a woman came up after the talk and commented on how the size of the child's foot told you whether or not the child was going to persist in stuttering or recover. And that's okay. Let me tell you, when I was a younger clinician last week, I used to try to convince parents of the truth of the matter. And I don't anymore. I don't anymore because I've learned two things. One is I'm never going to convince them. It's just not going to be possible. All the facts in the world, I end up trying to persuade them rather than valuing where they are. So now what I do is I say there are many different ideas that are out there. What I focus on as a speech language pathologist is strategies where we have research evidence. Now, I know, believe me, I live in the United States of America. I know a lot of people are uncomfortable with scientific evidence, okay? But we can do better than that in this field. We can follow evidence based practice. So I would say that, yes, people have said things like that that might make a difference, but it is not the most common strategy, and it's not one that I, as a professional, can recommend. I can't tell you what you as a parent ought to do. I can tell you what you as a parent ought to do if I were the parent. I can tell you what I would do, but I can't tell you what you should or shouldn't do. I can only make recommendations, and my recommendations that I make to you are going to be based on the evidence. And we have good evidence. We have good evidence. Now, that's one thing. It's not going to convince everybody, but it does give me the opportunity to value where they are and let them know that I hear them. That builds the therapeutic alliance. And the stronger that therapeutic alliance is, the more trust the parent is going to have in me. The more trust the parent has in me, the more likely I will be able to provide accurate, authoritative information without it being questioned. So I view the way out of this as a process rather than just a convincing. Is it satisfying? No. I'd rather tell them, don't do that. But telling them that isn't effective.
Yeah, and I think Scott just made the point that that when you do that, Scott, that parent feels heard and not dismissed. And then there's a greater likelihood that over time, because you're developing that relationship, that that parent is going to understand that you've got some game on this and that you know the facts and the research, and there's going to be a shift down the road. And I think that's the most important part. I think the cool thing about us having our own office hours is we can go over a couple of minutes. It's our show. And so I see one more question, Scott, unless you see
I'm
something
covering
else.
it. I'm doing that one typing. I'm covering that one. So you
Are
go
you
for the
covering
one
that one?
about the true stutter, one of my favorite topics.
Oh, yes.
Go for it.
Well, let me start and then you piggyback. Yes. Um, this I'm going to answer this question in a way that helps us answer the question of any parent who ever gets to us and says, blah, 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 this happened, should I do this? Okay. And what I think is going on here is that the way in which this lady asked the question about being an SLP and a parent of a child who stutters, um, the SLP had told her that he doesn't need therapy because he doesn't have a true stutter, because he mostly produces whole word and part word repetitions. Should I seek another opinion? Can I just say the way in which you pose the question lets you know your answer. Trust your own gut on this. I'll validate it for you. Yeah. It seems like a second opinion would be appropriate because you're not feeling like that is the truth for your child. here's what may be happening. This other speech language pathologist has seen certain things in your son and maybe hasn't seen the whole picture, which you see every day. So you know that what your child is experiencing is not normal for him. And you're concerned enough to go to a speech language pathologist. And so I think if you're still feeling like you need more information, than a second opinion would never be a bad idea. Scott, you want to talk about the true stutter?
Sure, I'll be brief on this one. And I did just type out, Hussein had asked a nice question about, is it necessary to use a treatment program? And I gave a response to that in the chat,
Okay.
since we are tight on time. Um, but yeah, long time in our field, we talked about real stuttering, true stuttering, developmental stuttering, and I find those terms confusing. I really do. And so there's been a movement amongst several of us to try to just do away with this notion of what a true stutter is. What we say instead is the child of this age exhibiting stuttering behavior? And if so, then we'll call it stuttering. Okay. We don't have to worry about real, not real. Because otherwise, it's like next time I break my arm and I go to the physician and she says, well, let's see if it heals. Because if it heals, that means you didn't break it. And but no, that's not right, right? Because they were saying if you got better, then it must not have been real stuttering. It was developmental. It's just confusing. So instead, is the child stuttering, yes or no? Okay, that's an easy question to answer. The more important question, and the second question is the child likely to continue stuttering? And if the child has those risk factors that I was talking about before, then we're going to go for treatment. If the child is stuttering but has minimal risk factors, then we can be less urgent in our treatment. Doesn't mean that we won't maybe provide some treatment just the same, but it won't be with that same degree of urgency. So, given that your child is male, boys are more likely to continue stuttering than girls, and has been stuttering for 2 years, time since onset grows as a risk factor over time, then I would want to be sure to get an evaluation from somebody who specializes and get that second opinion that Nina was talking about. That doesn't mean he's definitely at risk, and I'm not providing diagnosis by telepractice, okay, by and not having seen the child. But see, then on the other hand, you say that it's mostly whole word repetitions, which is less of a risk factor. The part word repetitions, that's stuttering behavior. So what we do is we take all these things in balance. In case it's helpful for you, on our website, we do have materials specifically for parents of young children who stutter. I'm going to show you one, and then I'm going to tell you another place where you can get a bunch of free resources on this. Here is just a booklet that we wrote specifically to help parents of young children who stutter navigate this confusing time. What should I be worried about? What shouldn't I be worried about? Is there a technique that I should be using now? Do I need an evaluation? The other place to go is on our website to our blog. And on the blog, you will see several questions about early childhood stuttering. For example, don't just tell parents to wait and see what's happening, wait and see what happens. What are the different treatment approaches for preschoolers? And in particular, how do I know if treatment is indicated for a young child who stutters? All of these materials are freely, these materials, the blog posts are freely available on our website. But please also reach out to Nina and to me because we'll be happy to help however we can. We know that it's a worrying thing to watch your child go through this, and we want to help you through that however we can.
Exactly. And I think we've exhausted most of the questions in the chat, and it's a little bit past our time. So we want to say thank you very much. We hope you join us next Friday. We're going to do it again. This time it won't be on what ended up being a holiday that we forgot was coming for many parts of the world.
A couple
And, you know,
holidays,
that's
yeah.
because neither one of us actually know what day it is anymore. So I think, like many of us, so we really appreciate you being here, and we hope to see you again soon.
Thanks, everyone.